I'm Tito Lopes. I'm a specialist in gynecological cancer at the Royal Cornwall Hospital in the UK. I'm going to talk about cervical cancer, the human papillomavirus, about cervical screening, and briefly about the vaccine for cervical cancer. The cervix is what's commonly known as the neck of the womb. It's the lower part of the uterus, and part of it is visible from the vagina. It's rare in the UK, partly because of cervical screening. It's the 12th most common cancer in women, and there's just under 3,000 cases a year. However, cervical cancer is the second commonest cancer worldwide in women after breast cancer, and about 500,000 women are diagnosed with the disease every year. Unlike most cancers which occur in the elderly, cervical cancer has a bimodal distribution. That means that the commonest incidence is in women aged between 30 and 35, and then there's a second peak in women in their 80s. As I mentioned earlier, it's most common in developing countries in Central and South America, Africa and Asia, and the reason for this is primarily due to the lack of cervical screening. Cervical cancer arises in women who have persistent infection with a virus called human papillomavirus. We're going to abbreviate that to HPV. There's about 130 HPV types that affect the human, and 40 of these affect the male and female genital tract and are passed by sexual transmission. However, only 15 of these are considered to be high risk for cervical cancer. Eight out of 10 of us who are sexually active will have a human papillomavirus sometime in our life. Most of us clear the infection, but for a few of us, about 1 in 20, it will persist, and in these cases it may progress to a potentially precancerous condition called cervical intraepithelial neoplasia, or CIN for simplicity. The majority of early CIN will eventually return to normal. In a very small number of cases, it will progress over 5 to 20 or more years to cancer. CIN doesn't cause any symptoms, but fortunately it can be detected by cervical cytology, what we traditionally call a cervical smear. A few years ago, the screening program changed over to what we call liquid-based cytology. A small plastic brush or broom samples cells from the cervix, and instead of smearing cells onto a slide, which is why we call it a cervical smear, the cells are dispersed into a vial with fluid, which is then sent to the laboratory for preparation and examination under the microscope. The cervical screening program has been very effective. Since its introduction in 1988, the number of cervical cancers in the UK has halved. The most important thing in any screening program is population coverage, which means screening as many of the population as possible. For many years in the UK, there's been excellent compliance with over 80% of eligible women having cervical smears. Unfortunately, in the last 5 years, this has dropped below 80%, and especially so in women aged 25 to 30, where it has dropped to 60%. One realizes that half the cancers now diagnosed are in the 1 in 5 women who are not up to date with cervical cytology, it stresses how important it is that all women, especially the young aged 25 to 35, have screening when invited. More excitingly, in the last 5 years, 2 vaccines have been licensed to prevent cervical cancer. Both vaccines target and should prevent cervical cancer caused by HPV types 16 and 18, which account for about 70% of cervical cancers. The UK introduced a national vaccination program in 2008 using one of the vaccines, Cervarix, for girls aged 12 to 13. In September 2012, that's this year, the vaccine will be changed to the other vaccine, Gardasil. Like Cervarix, it targets cancers caused by HPV 16 and 18, but also targets HPV types 6 and 11, which are responsible for genital warts. In conclusion, cervical cancer is uncommon in the United Kingdom because of cervical screening. Cervical screening detects a potential precancer change called CIN, which is easily treated in the clinic, therefore preventing cervical cancer developing. Women not attending for regular screening have a significantly increased risk of developing cervical cancer. Therefore, it's important that all women should attend for the cervical screening when invited. The UK National Vaccination Programme offers all girls aged 12 to 13 a vaccine which should prevent 70% of cervical cancers. It's important that parents should ensure that their daughters do have this vaccine. Lastly, it's important to remember that the vaccine only protects against the 2 most common HPV types associated with cervical cancer, and it is therefore important that even women who have been vaccinated should continue with the screening program.